Okay, great. So my name is Ella Crawford. I am the Residential Admissions and Recruitment Coordinator here at Berkeley Public Health. I work specifically with students who are interested in our on-campus programs. We do have an online MPH, and if that is something that you are interested in learning more about, I would really encourage you to go and talk to their admissions team. They are fantastic and will be able to answer all of your questions that I certainly will not be able to. Today's presentation, we're going to go through in a very sort of general look at the on-campus graduate programs. And then I'll be finishing off with recommendations for how to submit a strong application, what the tuition looks like, what funding looks like, as well as admission requirements and things of that nature. If you still have questions after today's presentation, you are welcome to email us, and I'll be providing that email at the end. I'm also going to do my best to get through the portion where I talk at you as quickly as possible so that we can get to a sort of live Q&A at the end. If you have any questions as I'm moving along here, feel free to add them into the chat. I have a terrible memory, and so I'm either someone who has to a question down or get it out there as quickly as possible, and you're welcome to do that. Because I'm sharing my screen, I'm not able to look at the chat, and so I will take a look at it once we are in the sort of live Q&A portion. So okay, I think that's all the information you have to know to get started. So let's go ahead and begin. Okay. So as you're starting down your graduate school journey, you have a really big decision ahead of you, right? Trying to figure out what is going to be the best program in school to spend your energy, money, and time at. Graduate schools are very purposefully very niche in whatever topic or research topic that you're looking to do. And the faculty that you're working with and the school community itself plays a huge role on whether or not that graduate program is a success for you. So what I always encourage students to do is, start off by looking at what the school's mission and vision is, as that will tell you a lot of what they're focusing on in their goals for the future, in their research, and what's really important for them. So on the left-hand side, you can see our vision statements, which is health is a right. We believe in social justice and the basic human right to a healthy life. Strength through diversity. So we welcome diversity in our education, our research, and our service. We want our students to think forward, and so we're training them to lead in innovation. And impact first, demonstrating our commitment to maximum impact by focusing our research, education, and service efforts in areas that have the most transformative impact on health. And given that public health is really about serving the populace, that last one, really serves an important role in that. Our mission is to improve population health, especially for the most vulnerable, and we do this through radical collaborations by providing preeminent education and engaging in transformational research on the major public health threats and opportunities of today and tomorrow. So looking at our school by the numbers, just to give you, more of a general sense, very high-end sense of our school. The average amount of funding is going to be around 22,000. Our MPH students for 2021, about 15% of them received an offer of funding. Our graduate programs, we have 35 different programs available. The professional degrees had a 39% acceptance rate for our 2021 school year, and the academic degrees had an 11% acceptance rate. I get a lot of questions around acceptance rates, especially being UC Berkeley. We have a reputation for being a tough school to get into. And if you're ever asking schools about acceptance rates, make sure to clarify, what kind of degree you want to better understand, because oftentimes all of these numbers just get lopped together and you get a general acceptance rate that may not be very accurate to whatever program you're applying for. We have 740 graduate students, and this number represents not only our on-campus graduate students, but also our online MPH. So there isn't 740 students, every day on campus in the building. About 250 of those are going to be our online MPH students. And then you can see a further breakdown of our demographics of our student community at the bottom of the screen there. And if you want to see an even further breakdown, you can go to our website and get even more data. So this is the 35 different graduate programs I was talking about earlier. And one of the things that you want to keep in mind is that when you're applying to our school, you don't apply for a general MPH and sort of, figure out what your track is along the way. You actually have to decide in your application process which concentration you want to apply for and then apply directly into that one. So our most popular is the 2-year Masters of Public Health. You can see the concentrations available for that one on the top left-hand side of the screen. Underneath that, we have our 1-year MPH. And so the 1-year MPH is really meant for students who already have an advanced degree or in the process of completing one. And if you're unsure whether or not that applies, if you apply for that, you can check our admission requirements on the website. The joint program. So we have a lot of schools here in the Bay Area that we work closely with. And so you'll see the joint programs are some of the results of those relationships. So we have a joint medical program, JMP, with UCSF, and you will first get an MS in health and behavior here at UC Berkeley. And then you will go over and complete your MD at UCSF. And I'm going to talk about that one a little bit more later. And then you can see the rest of the different joint programs that we have available as well. Our doctorate of public health sort of falls within the interdisciplinary discipline. And unlike our other doctorates, this is still considered a professional doctorate. And you have a bit more flexibility in terms of what you want to focus on and which faculty members you want to draw into your research. Okay, now we're going back up to the top right-hand corner, our PhD offering. So we have PhDs in biostatistics, epidemiology, environmental health sciences, infectious diseases and immunity, and then finally health policy. Our concurrent MPH degrees, these are very exciting, very popular with a lot of our students. So one of the benefits of coming to a school like UC Berkeley is that you have the resources of a large university, but this sort of small community of a small graduate program at the School of Public Health. And one of the benefits of having that large research university right there is that you could potentially acquire another master's degree during your time with us. And so the concurrent MPH degrees on the right-hand side of the screen there are the different pathways that we have set up with other graduate schools at UC Berkeley. So Master of Public Policy, Master of Journalism, Master of City Planning, Master of Social Welfare, and then finally Master of Business Administration are the other degrees that you could potentially acquire while completing your MPH with us. And keep in mind, I've highlighted or I've listed out there which specific concentrations offer a concurrent degree. So not all of our MPHs also offer a concurrent option. So you want to keep that in mind when you're doing your research. And then finally, our Master of Arts and Master of Sciences, or Master of Science, these are our academic degrees alongside of the PhDs. And we have a Biostatistics MA and Epidemiology MS, an Environmental Health Sciences MS, and then finally a Global Health and Environment MS. So a lot of different degrees and concentrations for you to choose from. Oftentimes students already sort of have a particular draw to a concentration based off of their past experiences and what they're interested in pursuing in their career. And I encourage you to go onto our website, as we have like handbooks for every single one of our concentrations. So you can look over the curriculum and look over the coursework and sort of see what students do with what they're learning at our school. Okay, so I'm going to kind of go through each concentration so you have a better idea of what specifically it's focused on. So biostatistics is the development and application of techniques to improve the understanding of data. We offer a PhD, an MA, and an MPH in epidemiology and biostatistics. Epidemiology is going to be one of our very popular concentration options. This is going to study the factors that determine the distribution of health and illnesses in human populations. I like to think of epidemiology as the concentration for the really the folks who are really geeking out about epidemiology and really want to understand the research methods behind it. I'm going to kind of go over this a little bit later, but we have concentrations where you can still become an epidemiologist out of these concentrations. So you don't have to do the epidemiology one in order to pursue that. Health and social behavior, I would say that this is going to be our most social justice oriented concentration. So students who are really interested in these social determinants of health oftentimes go into health and social behavior. This program does require that you have at least 2 years of public health experience post bachelor's degree. And that is by the time that you matriculate into the program, not by the time that you apply. So if you will have 2 years by the time that you start, that's totally fine. Health policy and management. I want to be really clear here that, there's the word policy in this concentration. And so oftentimes people think that it's like policy making at the governmental level. This is actually really more so, this concentration is more so focused on healthcare, things like insurance, and so policy within that, within those systems. Infectious diseases and vaccinology focuses on interactions between infectious agents, their hosts, and the environment. What I've been told from a lot of students is that we're one of the few public health schools that actually offer concentration in this, which is very exciting for us. Maternal, child, and adolescent health, sort of very similar to epidemiology in terms of it being very quantitative heavy and going to be focused on that research and service, but it's going to be with the specification of the health of moms and babies. So public health nutrition is going to be looking at food systems, trying to understand nutrition knowledge as well, and policy on improving public health through nutrition and through those food systems. Environmental health sciences is going to look more so at the impacts of physical, chemical, and biological agents in the environment and in the workplace on people. So they're going to be ones looking at, how is pollution affecting us, or, for people when they go into their job, how is the equipment that they're working with affecting their health long term, and things of that nature. Global health and environment is actually sequestered within the environmental health sciences concentration, but they are still considered separate, as there's going to be much more of a global impact focused on this one. So students who are in this concentration are looking at low and middle income countries and the development of health and public health within those, and environmental factors are also included in that. And then finally, our interdisciplinary concentration. So this one is much more customizable in your curriculum than the rest of them are, and you're able to pull in faculty members from not only across the public health school, but also within the other schools at UC Berkeley. So you're really going to be able to work with all different types of researchers, faculty members, to figure out what's going to be the best curriculum for you. Oh, and I know I said I was going to mention it later and then I didn't, but like the environmental health sciences concentration and the public health nutrition concentration, there's epidemiologists who come out of those two concentrations as well as, any of our others. One of the things I like to be really clear with students about is, yes, you have this concentration and you're taking, lots of core courses in order to get a degree with the specialization of what that concentration is, but you also have these breadth classes that every public health student has to take in order to graduate, regardless of what your concentration is. And it's going to include some epidemiology within those breadth classes. And then there's also, a part of your coursework where it's elective. So you can really decide what you want to do with those electives. And students will take classes in the other concentrations within the School of Public Health. They'll even take classes at the other schools within UC Berkeley. Specialty areas, I want you to think of these like minors. First of all, they're totally optional, so you do not have to take them. But if you were interested in, a couple of different concentrations and you're having a hard time deciding, the specialty areas can be a really great place for you to start, as you can, focus still on your main concentration, but then also get a specialty area in something like global health. So you do have to, in order to suffice a specialty area, you have to take a certain number of credits in order to fill that. Like I said, you really want to consider these like minors. That's the best equivalent. I already had the concurrent degrees in there. There are sort of various concentrations listed in the previous slide, but I think this gives you an even, definitely a closer view of it. And the font is a bit bigger, so you can tell. But like I mentioned earlier, not all of our concentrations have these different concurrent degree options. So if you're thinking about doing a concurrent degree, you want to think about what's the best concentration for you as well. And then finally, for the Master of Social Welfare and MPH, as well as for the Master of Business Administration, MPH, those two you actually apply through the other graduate schools that we do them with. So you wouldn't apply through our application portal, you would apply through theirs. And this information is listed on the website if you forget. Okay, so the joint medical program is a really popular program for students who are going in and getting their MD from UCSF. They actually start at UC Berkeley for the first, so the MD in all is like a 5-year process. So the first 2.5 years, they'll start here at UC Berkeley. And they really like this sort of integrated academic and professional approach to learning medicine. They'll have like their foundational courses in public health and health systems. They also have a lot of more like case study based research. And so it's very practical. You're working with your fellow cohort to sort of figure things out and work on these different projects. And then the final 2.5 years, you go across the bay over to San Francisco and complete your MD at UCSF. Is there anything? Oh, one thing to keep in mind, if you do decide to apply for the joint medical program, you actually first apply through UCSF. And then if they invite you back for like into the second application process, the second interview, that's when you would indicate on your application that you want to be considered for the JMP. Okay, so now we get into my favorite part, which is the different resources and offices that we offer here. So first, I want to go over our DREAM office. So that stands for Diversity, Respect, Equity, Action, and Multiculturalism. And this office is not only going to be available for our current students, but also for our prospective students. So the things that they really offer is education and advising about public health careers and Berkeley Public Health. So oftentimes when I go off and do my recruitment at various colleges or graduate fairs, I'll also have someone from the DREAM office coming and helping me as well. And they also lead a lot of recruitment opportunities. And so, we see as our job as not only educating people on our school of public health, but also on the opportunities of what the public health field can look like as a career. They do provide application assistance, and so you can attend their advising and admission workshops. You can even have a one-on-one advising appointment set up with one of their ambassadors or one of the other folks that work in the office. So those are kind of the main things that they offer to prospective students. And then for current students, they do offer peer mentoring and support, as well as support program concentrations during graduate school through transition courses, tutoring, textbooks, and more. So they're truly a phenomenal office. They do a lot of really incredible stuff. And one of the aspects of the program I really like to promote is their grads ambassadors. So these are current students who work for the DREAM office, and their role essentially is to connect with all of you. So if you really want to talk to a current student about their experience in the concentration or at the school, you can connect with them by emailing sphgrads@berkeley.edu, and they'd be happy to set up an appointment. On the flip side of that, so we've got DREAM and then we have RISE, and RISE is our careers and leadership office. So the sort of main pillars of what they're assisting with is career services. So that moment for when you leave our doors and you have your degree and you're ready to go off and start your public health career. They're going to help you with not only providing tons of like network and career fairs, one-on-one advising appointments. They also have a job board for on-campus jobs, as well as jobs for when you're ready to graduate. And they have a lot of networking and like relationship and partners with a lot of people right here in the community to assist you with finding that next step. The second part of that is the public health practice. So for our 2-year MPH students, you will complete an internship between your first and second year, or it's really more of a practicum internship. You'll hear us use those both words interchangeably. So they're going to help you not only find that right practicum experience for you, and you can see some of the internship locations listed there. So a vast majority of students stay here in California, about 77% of them. 15% of students will go international, and 7% will stay here in the US, but will go to different states. I sometimes get questions around study abroad. So unlike in undergraduate institutions, we don't offer study abroad opportunities. There's frankly like not enough space in a schedule in order to make something like that work. But the internship can be a really great opportunity for you to go and globally. And then on the right-hand side of the internship locations, we also have the different sectors that people went into. So you can see kind of where people ended up. And then finally, leadership development. And so this is going to be a practical leadership course that the RISE team offers. And that's more along the lines of assisting you with figuring out the actual practice of public health. So what does this look like? How do you be a leader in public health? And sort of having those discussions with you and providing resources and assistance and training on being a leader and a public health practitioner. So in terms of where do graduates go once they graduate, this is the breakdown. This data is from 2019, so you want to keep that in mind. But I think it's still a good example of where students are going. So we have 5% going into government health agencies, 8% into nonprofits or consulting firms, 11% going into academia, another 11% going into biotech, 14 healthcare systems, fellowships, research, government work, and then 27% continuing their education. So, you know, you want to have a better understanding of where could a career in public health kind of lead. And I think this gives you a good overarching view of what that could entail. So our different student resources. So I like to start this part off with kind of a mention more towards UC Berkeley's history of being like a very student activist centered place, starting with the free speech movement. And I think UC Berkeley has a reputation for being really big on justice and social justice. And I think that, you know, that is well earned in a lot of ways. And I like to talk to students a bit more about what kind of resources we are actually offering to students to make sure that they're being taken care of, not just in terms of that academic side, but also that they're leading, you know, a healthy life. So for any international students who are in the room, I really, really want to encourage you to check out the Berkeley International Office. So they provide advising for non-immigrant students, scholars, staff, and faculty. They do have visa document production for non-immigrant students and scholars, as well as programs and workshops for students and scholars to help answer any questions you might have about that visa process or other international student questions. I know that they sometimes also provide like different scholarships that international students can apply for. So that might be something that you want to check out. Our Basic Needs Center is sort of like a center if you find yourself in kind of an emergency. So whether that be emergency housing or food insecurity, that's what they're there to help students with. And so they have a program called CalFresh. It's a government food program, so they can get you hooked up with some food. We also have a food pantry through them, so you can go and grab food if you need it. We actually, the School of Public Health specifically has a relationship with them, and so they will provide us with a bunch of like packaged food that will last a while, and we have it at one of our kitchens in the building, and students are absolutely welcome to go up. No questions asked, you don't have to tell anyone, you just go up and grab as much food as you need. Emergency housing, so they can assist you with figuring out what, if you find yourself in an emergency situation and you need to get housing quickly, you can go and talk to them. They have a lot of different resources. They also have a fund, so if you need to apply for like emergency funding, you can do so through them. We have our student parent center, who also has a lot of housing resources, and they go through, like, they have a map of campus of all the family friendly landmarks. I actually only picked out like 2 of the maybe like 10 different things that they offered. And so I highly encourage you to go and check out the center. We have an undocumented student program, and they provide really individualized service for each student. So whether you're needing assistance with like legal advising, or even just like wanting to feel connected to the community, any kind of advising that you need, they're a fantastic resource for you to use. Our Centers for Educational Justice and Community Engagements, these really blossomed, I would say, out of like our student activism that we see on campus. The community engagement centers are really student-led, and so they're starting with, what do students sort of need and want to see on campus. And then finally, our counseling and psychological services, or CAPS for short. We refer to them as CAPS very frequently. So if you hear that, that's what we're talking about. They're also available for students to use. Okay, and then switching over to the research side of our school, going back to, graduate programs and finding the best one for you, I really encourage students to go and look exactly at what research is being conducted at the schools that you're looking at. So we have these research centers, and we have so many of them, I could not fit them all on the slide, where they're going to be looking at very specific kind of research topics. And if you are interested in pursuing one of those, you should absolutely do that and go and talk to them and see how you can make that happen. But we already have a relationship with them as a school of public health, and that's what the research centers are there for. And then also go and check out the research being conducted by faculty. And I'm going to talk about this a little bit more later when we're discussing the how to submit a strong application. But make sure that the research that you're interested in pursuing is actually being done by our professors, and that they're still doing the research that you really want to pursue. And that can even give you a better sense of whether or not a school is a right fit for you. Okay, so now we're going to switch over to the nitty-gritty, tuition fees, admission requirements, and application instructions. And okay, we're about 5:30, so I'm going to do this as quickly as I can so we can get to the live Q&A. But like I said, if you do have any questions, please feel free to add them into the chat, and I will get to those at the end. All right, so this is what the tuition breakdown looks like for our academic degrees. I'm going to show the professional degrees in just a moment. So the academic degrees, like I said earlier, are the MS, the MA, and the PhD. And there is a difference between California residents and non-residents. So residents refers to students within California. You can apply for California residency after the first year, and there's information on how to do that through the registrar's website. Now, the, what do I want to, okay, yes, so the numbers that are highlighted in red, we have the new master's total and the new doctoral total. That is the cost that you will pay for the very first semester that you are with us. And then the continuing student total, which is highlighted in green, you will pay for every semester thereafter. So that's sort of the difference between the cost overall. And then this is our professional degree tuition. So you'll notice that there is a bump, and that is the professional degree supplemental tuition, PDST for short. And that is what sort of pays for a lot of the practicum elements, the leadership development, the career services, and any other sort of faculty that we're bringing on board in order to go through with, or in order to meet the requirements for the professional degrees. So that particular supplemental tuition does typically go up from anywhere from 2 to 5% each year. We actually are keeping it at this cost for the next 2 years. That was like a really important for our school, especially coming out of the pandemic and the economic recession. And so that number will stay the same, at least for the next 2 years. And similar to the academic degrees, for the very first semester, you'll pay the new MPH student total or the new DRPH student total. And then for every semester thereafter, they'll pay the continuing student total. So what does funding look like? So funding can come from all different places. FAFSA and federal loans. We always encourage students to submit their FAFSA if they do plan on registering with us. You will be considered for merit and need-based fellowships during the application process. So on our application, we have a couple of questions around whether or not you want to be considered for funding. If you do, you will select yes, and then you will answer the follow-up questions around that. Training grants are things that are specific to each concentration. So not every concentration has a training grant, but some of them do, like our maternal, child, and adolescent health does have a training grant. So if you're going to be doing research that falls in line with a training grant, there is opportunity there for financial aid. And you'll want to ask your program manager if there are any training grants available for you to consider. Graduate student, instructor, researcher, or assistant are really popular jobs on campus. You'll hear us say GSI, GSR a lot. That's what that's in reference to. About 30% of our students do have one of these roles. And depending on how much you're working a week, so if it's, you know, a lot of hours a week or a little small amount of hours a week, you either will get like supplemental tuition, so they'll pay like some tuition remission, that's the word I'm looking for. You'll get tuition remission and a stipend each month, or you'll just get the stipend each month. So the more you work at one of these positions, then it's going to be tuition remission as a part of that. And that's decided by what kind of position it is. And then, of course, we are in a really urban area, and this is one of the benefits of being in a place like this is a lot of students will have off-campus jobs or internships that are part-time. Some of the internships that they'll have over the summer for the MPH will even continue on into a job during the year. And then there's also external funding opportunities. And so I definitely encourage you to do your research and figure out if there is other places where funding can come from. I know AmeriCorps, we have a relationship with them, but that's something to consider. And then I pretty much already went over some of the average funding award, and the range of packages can be anywhere from $2,000 to $55,000. And we gave about $1.8 million in funding last year. Okay, admission requirements. So these are our residential general admission requirements. First off, you need to have a bachelor's degree or recognized equivalent from an accredited institution. If you are an international student and you're unsure whether or not your degree qualifies, then please email us with the name of your degree, the number of years it took you to complete it, and confirming whether or not the school that you took it from or received your degree from was accredited. A satisfactory scholastic average. And so we're looking for a minimum B average or 3.0. And we focus on the work completed after the first 2 years. Now, if you don't have a 3.0 and it's a bit below that and you're like starting to panic, don't worry. I will talk about this a little bit more. We do still encourage you to apply. Enough undergraduate training to do graduate work. So we want to make sure that you are prepared for the coursework, that you're going to have to take. This is a very quantitative, heavy sort of set of concentrations, right? One of the basic classes that all students are going to have to take does have quite a lot of quantitative stuff in it. So make sure that you have, you know, enough background in math in order to do well in some of these classes. And then different programs require different things. So, okay. I'll talk about that later. Then we're going to have evidence of English language proficiency. So this is only for applicants who graduated from institutions in countries where English is not the dominant language spoken. Some international countries, we do not expect you to submit English proficiency scores. Others we do. I always encourage students to just check with us directly to make sure. And then finally, please submit all required application materials. So in order for your application to be reviewed, we want to see that we have all of those materials. So this is the checklist. You can find this on the website. Please keep in mind that international students will have to submit a WES evaluation through the SOFAS portal, as well as official TOEFL or IELTS test scores if applicable. So like I mentioned earlier, each program does have a separate set of requirements, or in some ways they're kind of like really strong suggestions. On our admission requirements page on the website, we go through each concentration and degree and what they're sort of looking for in a strong applicant. And that's a really great place to start if you're trying to figure out whether or not this degree sort of makes sense for you and your background. Okay, preparing a strong application. All right, so graduate school is very complicated to apply for, and I always want to like celebrate with students when they finally get their application in, because I feel like half the battle is really understanding what exactly you have to do in order to apply. We have an application instructions page on our website. It is very wordy, and I know that, and I apologize for that in advance. But the reason for why it has so many words is because all of those instructions feel really important for us. And we go through a lot of detail on not only how to submit each and every single item, but also best practices for submitting each and every single item that we ask for. One thing that you'll want to keep in mind is that not every concentration and degree application is the same. So at the very top of our application instructions in bright red, we have the instructions for different concentrations that sort of diverge from the rest of our programs in terms of what they're asking for in the application. We always have students who have challenges with this or do it wrong, and the application comes in and we have to come back and ask them to redo certain aspects of it. Please don't let this be you. Go and look at the application instructions page and make sure that you are applying correctly for the program that you're applying for. And come talk to me if you're really still unsure, and I'm happy to talk it through with you. Okay, so we do have two different application portals, and when students apply, they have to apply to either both of them or just the UC Berkeley graduate application. If you apply through SOFAS, you will have to submit a reduced version of the UC Berkeley graduate application. If your program only asks you to apply through UC Berkeley graduate application, then you will submit the full UC Berkeley graduate application. Keep in mind that there is an application fee for both, but if your program has you apply through SOFAS, the UC Berkeley graduate application cost is reduced. If you only apply through the UC Berkeley graduate application, then you do have to pay the full $140 application fee. There are application fee waivers. They are not handled by the admissions office at the School of Public Health. They are handled by the people who run these two application portals. And you can find the application fee waiver information on the websites of both of these places. Okay, now I'm going to go through sort of each item that you need to submit. So each one that was on that checklist. I mentioned earlier that I was going to get back to the 3.0, and here it is, I'm doing it. So if you do not have a 3.0, we do actually still encourage you to apply, as we have admitted students in the past who have an under 3.0. They're usually showing us in other ways that they have training to prepare them for the degree. So whether or not it's additional research training, they've gone and they've worked in the public health field, and they have training around that. So if your GPA is sort of below that 3.0, there are other options and ways to strengthen your application overall, and we would still encourage you to apply. GRE, I get questions about the GRE all the time. So for a lot of our concentrations, it's going to be optional for 2022 and 2023. So it was optional for this last year, and it will be optional for a lot of these in 2023 as well. This chart is available on our application instructions page, and I would encourage you to go and check back. The closer we get to the application portal's opening in August, to double check that you will or will not need the GRE. If you decide to take the GRE, so even if your program says that it's optional, but maybe you have a below a 3.0 and you want to show that you still have strong quantitative skills, taking the GRE can be a good option for you. Make sure to aim high, give yourself plenty of time to study. It's okay to take it more than once, and the GRE does last for 5 years. And so you can take it now and apply in 4 years with the same GRE, and we will accept at-home tests. If you choose not to submit a GRE, it will not disadvantage you in the application. It's not like, if a student didn't submit a GRE, they're immediately put into a non-review pile. We will review absolutely everybody. We do encourage you to take the GRE if it can kind of supplement something else that's lacking in your application. So like I mentioned earlier, if you have a below a 3.0, or maybe if you have a transcript and your classes are good, but you have a low math class grade. So taking the GRE and doing well in the quantitative section can be a good indicator to the admissions review committee. So yeah, if you don't want to take the GRE, but you do want to sort of up your quantitative aspect of your application, one of the things that we actually advise is like take a stats class, take a math class, and do well in it, and show the admissions committee that you have what it takes to be in the concentration. All right. So for the English language proficiency, applicants who attend a college in a region where the official language is not English, we will require that you submit those. And the minimum scores for that are either on the paper TOEFL test 570, on the internet a 90, or the IELTS a band score of 7. There are some exceptions to whether or not you have to take the one of these English proficiency tests. Those are listed on the application instructions page. And we do not accept Duolingo. And even if you have like an English proficiency certificate that you got in school, we will not accept that as well. We want to see the language test. We want to see 3 letters of recommendation. At least one of these should come from someone that you worked with in an academic setting. So if you have graduated from college in the last 5 years, the admissions review committee is going to expect to see a letter of recommendation from a former faculty member. If you worked closer to a TA than you did the professor, we have accepted letters where a TA and a professor co-wrote it. And that can actually be a really, really great thing, because if a TA really gets to know you, then that's what we want to hear or see. It doesn't matter if the person that you ask is like the head of the department or dean of the school or whatever. We really want to hear from someone who did genuinely get to know you and can speak highly of you. Oh yeah, that's a tip that we give, is when you ask for a letter of recommendation, make sure to ask someone if they're able to give you a positive letter of recommendation, because they may agree and not have wonderful things to say. So make sure that you're checking with that. And it does need to be submitted on letterhead. Yeah, it needs to be submitted on letterhead. So the resume is a place where you can kind of further elucidate your experiences, employment opportunities, pretty much any public health related, whether it was volunteering or a great club or community you were part of in college. The resume is a place where you can add those experiences, and definitely make sure to specify any leadership roles. So we ask for 2 different essays to be submitted alongside of the rest of your application. And these are both incredibly important. We don't have an interview option, and so we really use these 2 essays as that interview. So for the statement of purpose, you want to be specific. You want to talk about why UC Berkeley. Don't just talk about why graduate school. We want to understand what exactly about this concentration, this program, this school are you really drawn for or drawn to. One of the biggest questions or sort of standouts during this past review process was faculty members kept feeling like they weren't really getting the meat of why a student wanted to come to UC Berkeley and join their program. They definitely were convinced that a student really wanted to go to graduate school and was excited about why graduate school. But if you want to stand out in the application process, this can be a really big component. We want to see that you've done your research, that there's a reason for why you have picked us, and not just because we're UC Berkeley, but because of the research that's being offered, the faculty that are here, the community, the things that matter to us also matter to you, whatever that might look like. The statement of purpose is really where you're going to talk about what you've done in preparation for the concentration. So that can also be a really great indicator of why this concentration. So if your work has taken you to do a lot of stuff within infectious diseases, then that not only prepares you for the infectious diseases in vaccinology and PH, but it also gives us a good reason as to why you want to pursue that concentration in particular. We do not expect you to come to us fully formed and absolutely perfect. And so, feel free to talk about also what you hope to learn from us. What skills do you not have quite yet that you're really hoping to gain? If you were, fully formed and totally perfect, then there'd be no reason to come to graduate school. And then we do recommend that someone at least look it over once or edit it. Do not send us your very first rough draft that no one has looked over. On the other side of that, I also like to tell students, which I feel like this advice feels counterintuitive, but don't have too many people look it over either. I definitely have like my handful of friends who I will ask to read my writing because they also don't try to steamroll me, right? And so you also don't want to get too many people telling you what you should say or what an essay should sound like. It should still sound like you and be personable. So the other side of that is our personal history statements. And this is really more so focused on you. I get a lot of questions about what is the difference between the statement of purpose and the personal history statement. And I feel like the statement of purpose is really trying to, again, answer that question of why this concentration? What do you hope to do with it? What are your future career goals? What have you done to prepare for this? The personal history statement is more about, talk about your life and who you are. It's that personal component. They should not sound exactly the same. If you've had any barriers, obstacles, or challenges, the personal history statement is the place to talk about that. So if there's a particular reason for why, for instance, your GPA is lower than a 3.0, and there could be so many different reasons for something like that, this would be the correct essay to talk about that more in. A lot of us faced a lot of challenges during the pandemic. If that speaks to you, then this would be the place to have it, or place to talk about it. Oh my gosh, okay, it's almost 5:55. Okay, so I'm almost at the end, I promise. For students who are applying for the DRPH, we do require a writing sample in that application. So writing samples should be no more than 7,000 words in length. And they should be all or mostly written by the applicant. I also have tons of students who want to submit writing samples even for concentrations that don't require it in their application, and that's totally fine. There is a place on the application where you can upload pretty much anything that you think is important. I even have students like email me and go, can you please add to my application, like after they've submitted it and can no longer edit it, and I will put whatever you send me on the application. It's important for you to feel like you really put your best foot forward, and that's important to me as well. All right, so we're finally at the Q&A portion. I'm hoping I'm going to take a little moment to drink some water here, but I'm going to stop sharing my screen so I can take a look at any questions that you have submitted. Like I said, this is recorded, so please don't take your video, put your video on. You are more than welcome to unmute yourself if you're comfortable with that. You can also add any questions that you might have into the chat, and I will do my best to answer them. Okay, here we go. Health policy management, epidemiology, and page focus. Can I skip the English language test since I have a master's from Canada and a bachelor's from India? there is a very specific exception to the English language requirement. Okay, so if you've completed a basic or advanced degree at an institution in the United States, okay. I just added in with the exemptions for the requirement. So essentially the English language proficiency test is determined by where your bachelor's degree was completed and not your master's. The only exception to that is if your master's was completed in the US or at a US institution abroad that is accredited by a US accrediting body. So even if you have the master's degree from Canada, if you have a bachelor's degree from India, we will still require that you have a TOEFL or IELTS test score. Thank you for that question. Okay. Did she say the GRE? Okay. Is the GRE required for this upcoming cycle? It depends on the degree. So during the pandemic, this is maybe backstory you don't need, but I'm still going to give it to you. During the pandemic, a lot of schools really didn't ask for standardized tests. There was a lot going on, but it also sort of caused us to stop and think about whether or not we really need standardized tests. I will not go into my own opinions on it. I am very anti-standardized tests, but that's a whole other thing. And so our school, thank you. I see that little clapping symbol. So our school, alongside a lot of our colleagues, decided to not require the GRE for that year. And then on like a probational period for a lot of our concentrations decided to not do it for 2022. And some of them also decided not to require it for 2023. So they were like, we're going to do this probational thing for 2 years. So a lot of our MPHs, for instance, are not going to require it for 2023. I'm not sure about some of the other degrees. That's going to be a longer conversation that we have during the summertime. I know that my team is really pushing for it to be completely done away with, but it's a conversation that we have to have with the people who review all the applications and ultimately decide what they want those requirements to look like. So I'm going to add into the chat the GRE requirement chart. It will be updated when there's more information, which I imagine will come up during the summertime. But for a lot of the MPHs, it will not be required for 2023. But you will want to double check just to make absolutely sure. Great question. Okay, not mentioned yet, but curious on that too. Okay, I'm assuming that's about the GRE. For PhD programs, do you suggest reaching out to faculty for potential research opportunities before applying? Also, do you need to submit writing samples for PhD or just DRPH? So I think health policy PhD also requires that you submit a writing sample. I would encourage you to look at the admission requirements just to double check on that. But I believe this year they decided to start requiring a writing sample as well. In terms of reaching out to faculty, I think it is always recommended to reach out to faculty. I think that there's something to be said about your name not being completely brand new during the review process, especially for the doctorates. I think that this is less true for the MPHs, but for the doctorates, they're very hard to get into because we only have funding for so many people. And I really do encourage students to reach out to faculty and even just to double check, like, hey, I saw on the website that you're doing this type of research. Are you still conducting this type of research? I would be surprised if faculty members continually updated their profiles on the website. And so you may want to reach out just to double check that they're doing the research that they claim that they're doing from what you're seeing online. But also I think that can be a really great way of saying, I'm interested in this. Is this something that you're also still working on? Is this something that you could see me pursuing at the school? So I think that it's a good idea for a couple of reasons. One, to make sure that the research that you're interested in is still being conducted. And two, I think that it's always a good idea to reach out to faculty if you're applying for a doctorate and make sure that they know who you are. Okay. Oh wait, no, I want. Okay. Can you apply to 2 concentrations under 1 application, i.e. top choice is epi, but you also want to apply to infectious diseases and virology? Yes. So no, but also kind of, mostly no. So you can only apply for 1 degree and 1 concentration per application cycle. You can't apply to like a whole bunch. On the NPH application, there is a question at the very end that says, if you were to be considered for another program, would you want to be? And if so, which one? It's, I think, articulated a lot better than that, but that's essentially the basis of the question is, could we consider you for a different type of concentration if we felt that you were better suited for, another one? And you would say, like, what's your second choice program to be considered for? And so you could say, yes, I'm applying for EpiBio, and, write all your stuff for EpiBio, but then at the end of the application say, yes, I would be welcome to be considered for infectious diseases and vaccinology. Not all of the concentrations are open to being considered as a second choice. So the epidemiology and biostatistics concentration is pretty competitive. So this year we had like a 20% acceptance rate, and they receive a lot of applications, and so they do not want to continue to receive, applications from other programs as well. So they're like, hold off, no, we don't want any more. But all the other concentrations this year, at least, were super open to receiving applications from each other. So yeah, that was maybe more information than you needed, but there we go. Regarding internships, do those take place over the whole semester, the summer? So those take place over the summer. And there's certain requirements about like how many hours you have to complete in order for the practicum to be considered completed. And that is like a requirement in order to graduate. So it's not that it's like, oh, you have to take 3 months to complete the practicum. It's that you have a certain number of hours that you have to meet. And however, within that time length, you've met them, as long as you've met them. Can you apply to start your graduate program in the fall or spring? Okay, so the start dates for almost all of the concentrations are going to be in the fall, and the fall alone. The way that it's set up with your cohort, it's, even if we have people like transferring from other schools, they don't even like transfer halfway through the year or anything like that. They come in at the beginning with the rest of the cohort, and they even apply just like a normal prospective student. They don't go through like a special transfer process. So all of our concentrations begin in the fall. The only exception to this is our 1-year programs. Those do start in the summertime. Although I think you can, no, I'm not even gonna say that. They only start in the summertime. The only sort of other exception I can think of is our online MPH. They have a couple of different start dates throughout the year. And so if you were really interested in starting at a different time, and the online MPH is also meant for people who are professionals. So the curriculum is part-time, completed online. And what's cool about the online MPH is it's still all UC Berkeley faculty members. It's not like it's a third party, but it's the UC Berkeley name. No, it's none of that. It's still the same curriculum, the same faculty members as the people who are taught in the residential program, but it's just online, it's part-time, and it has a couple different start dates. That was a great question. Okay, so it is past time by 4 minutes, but I'm happy to stick around as I know I talked a lot. Does anyone have any other questions that I can help answer? Thank you so much. Oh, yes. Thank you so much for coming. It was lovely being able to do this. I really enjoy information sessions because it's a great opportunity to start to hear from all of you, and then I get to work with you during the application process. So do not be a stranger. Please feel free to reach out. So this is our email, sphadmits@berkeley.edu. If you have any questions about the application process, admissions, about our community, anything at all, please feel free to reach out to us there. And if we can't answer your question, we will send you to someone who can. but I'm in that email inbox pretty much every day. There will be a recorded copy coming out of this information session. That sounded really like I was like a musical artist. Coming out now, coming out soon. I'm going to send it around tomorrow. So if you were like, oh my gosh, she talked so fast, or I wish I had that slide, or, whatever it might be, I will be sending this out. So you will have it available to you. All right. Well, thank you everyone so much for coming. Have a wonderful rest of your day or evening. And I certainly look forward to seeing your applications in the upcoming application cycle. Bye, everyone.